Well, our big focus on the show today, the vaccine drive. India has set a target of inoculating 30 crore people against COVID by July. But for various reasons, the mission is progressing slower than expected. In the first phase, which includes healthcare workers and frontline workers, 3 crore people were meant to be vaccinated, and so far 1.14 crore have been vaccinated. In the next phase of vaccinations will begin in March, and in the next phase, 27 crore people will be vaccinated, and this includes people over 50 and those with comorbidities, and this is expected to end by July. Now, details about exactly who will be vaccinated first, how it will roll out, those are still awaited. But there have been calls by experts and industry leaders to take urgent steps to speed up the vaccine drive, especially since cases have been down. But again, there's a fear of variants of coronavirus spreading. In fact, already we're seeing an increase in cases over several states. So that is a big concern. Well, to talk more about this, we're joined by Professor Giridhar R. Babu, Professor, Head Life Course Epidemiology, PHFI, Bengaluru, and Dr. Padmanabha Shenoy, Rheumatologist and Immunologist from Kochi. Professor Babu, first to you. I know this is an issue that you have been focusing on a lot, how to increase the vaccine, the pace of the vaccination drive. What do you feel needs to be done?
Yeah, thanks for having me on the show, Gagi. Now, in India, just within the public health sector, there are at least more than 10,000 designations called as auxiliary nurse midwife or junior health assistant female. They are routinely giving intramuscular injection as part of the universal vaccination program. In addition, there are more than 10,000 nurses within the public health system. So if just this workforce is used, and each of them, if they cover at least 100 people a day, we are thinking in terms of covering 2 million people per day. So that's the inherent strength of Indian public health infrastructure. Now, if we add private health workforce into this, easily 2 to 7 million people can be reached within a day, depending on how good the micro planning is. So there are a few prerequisites for scaling up to 5 to 7 million, which includes the first one being whether the vaccines are available or not. Second, do we have a comprehensive list of people to whom the vaccination has to be given? Elderly is easier because we have voter list, we can use that. But to get people with comorbidities, unless we do comprehensive surveys, which captures all these people, just to tell you, Gagi, 1 in 10 people have type 2 diabetes mellitus among the adults, 1 in 3 have hypertension. Nearly 50% of these people will not know that they have. They'll only know when they have the complications. So therefore, it's very important to A, diagnose, B, put them into sort of a registry where they get vaccinated on priority. That is the difficult but not impossible task ahead.
All right, Dr. Shenoy, your views on how to increase the pace of vaccination. In the first phase, the government had planned that 3 crore people would be vaccinated. We're almost at the end of the first phase, and we vaccinated 1.14 crore people. In the next phase, 27 crore more are supposed to be vaccinated by the summer. There have been calls by many, experts, by many industrialists to involve the private sector. If you could tell us more about that, and why do you think that we've had this slow pace? Is it the hesitancy? Is it to do with technology? What is the reason?
I think basically Dr. Giridhar Babu also to point out the same thing, that we have to increase the pace to 10 to 15 lakhs per day a minimum. So most important issue is vaccines are available in plenty. But what happens is in India, most of the states are vaccinating only 2 days a week or maximum 3 days a week. That is very, very low. So we have to vaccinate. So for example, in PCR test, we are doing every day, 7 days a week. Like that, we have to vaccinate on every day, and we have to increase the number of vaccination delivery platforms. I think vaccinating only those with comorbidities, we need to have the proper data. But most of the states, the data is not proper. So the only way out is based on age, more than 60 years, vaccinate maximum possible. And second thing is to make the vaccines available in public market. That also will, so that those affordable people also will get vaccinated themselves. So the government expenditure will be less, and you can vaccinate more and more number of people. These are the two things. But let it be open. Let us open it up to more than 60 years, so that 10 to 15 lakhs per day can be vaccinated vaccinate every day, most of the days, let the vaccination program run. And third thing is vaccinate above 60 years, everybody. All the comorbidities people are having, those people who are having comorbidity, the risk is high. The problem is identifying them, right people, is, I am afraid whether we are a bit late for that preparation. So, but age data with regards to age, we have very clear based on our voters list, Aadhaar card, etc., etc. So it is very much easier to implement on ground level.
All right, Professor Babu, this involvement of the private sector, what are the concerns around that? And this is in two parts, isn't it? Because one is to involve them in the vaccination drive being conducted by the state governments and authorities, and one is to have the private sector involved in, acquiring and giving out the vaccines, and that's something we're not, talking about just yet. But if you could tell us about concerns and how to involve the private sector.
Yeah, I think there are concerns both from the private sector and from the public sector in terms of how a partnership can be built. I think we have already seen how a trusting environment between the public and private for public purpose, that's the partnership that we saw even during COVID-19, which reduced mortality by efficient treatment. So those kind of innovative partnerships will have to be built. For example, I'm just thinking aloud here, can the vaccines be procured by the public health system, but private healthcare can just help in ensuring that these are used for the distribution through the vaccination sessions? Two, probably some incidental costs, those who can affordable can give to the private sector, whereas there need not be any profit as such in the public purpose program. But I also think there should be some out-of-the-box thinking here. For measles and rubella vaccination, few states were covered in one block. Like that, they could do more than 1 crore vaccinations within a month. By doing high-risk states first and then going to other risks like moderate and low-risk data is one strategy. Second is using all health workers, both from public and private, ensuring different kind of partnerships in different state governments, depending on what is the existing structure there, the existing mechanism there. You might also find many not-for-profit private sector who would want to help in such as Rotary International, who have helped earlier with the polio exam, pulse polio campaign. So there are different mechanisms that we need to explore.
Right, and Dr. Shenoy, like experts are saying that we need, because right now we had a lull in cases had really gone down across the country, and and that's the time to vaccinate very, very quickly so we can get ahead of the virus. Even now there are fears about the variant spreading, and that is one of the reasons being looked at as to why cases are now going up suddenly in some of the states, in Karnataka, in Maharashtra, in Kerala as well, the cases remain high.
Yeah, very true. If we give the virus to multiply more, infect more, the chance that it is going to mutate is more. So the only way to prevent new mutations is to limit the number of people who are susceptible. How can we do that? By vaccinating more people. Let me just take the example of Kerala. Kerala has around 1,100 to 1,200 primary health centers and community health centers. If these 1,100 and 1,200 centers can be converted to vaccination centers, we can easily, state of Kerala can vaccinate around 1 lakh people per day. Currently it is vaccinating something around 10 to 15,000. So it can be just 10 times multiplied. I understand that logistics needs to be arranged, but it is not impossible. Definitely we have to increase the pace by hook or crook. See, from when we had the pandemic, we had hardly the capacity to have face masks were not available, PCR tests were not done. It was technologically challenging to do that. But at the end of the pandemic, now we are doing around 4 to 5 lakhs PCR tests per day. If we can do that, country like that can do that, definitely I am sure vaccination needs to increase, the speed of vaccination need to increase by hook or crook. For that, we need political commitment to come up, and definitely the rate of vaccination has to at least doubled or tripled in next couple of weeks.
So right, that by hook or crook, we do believe that in the next phase of the vaccination, we're going to see the Prime Minister and other leaders being vaccinated publicly, and hopefully that will help people overcome hesitancy. Professor Babu, in Punjab, there's the government put out a diktat because there was a lot of hesitancy there. Even for testing in Punjab, we've seen a lot of hesitancy, and the minister said that in fact health workers and frontline workers who don't get vaccinated, if they do contract coronavirus, they're not going to be receiving any sort of free health, free medical treatment. What is your view on that?
That's unfortunate, Gagi, because I feel in this mechanism of getting people vaccinated, we should not overdo things. And always, any coercive techniques have been counterproductive. I have experience of 6 years in polio eradication program. I can tell you with guarantee that whenever any coercive measures have been tried, they've always resulted in greater resistance and not lesser resistance. It's always possible only through community participation, more and more awareness campaigns, and over a period of time, people do get vaccinated. There is no hurry that within a week everybody has to get vaccinated among healthcare workers. There are different kinds of problems, and once they see the role models getting vaccinated, as you said, the vaccination coverage is going to improve. That's one. The second aspect is, once general public, especially the elderly, are waiting for getting vaccinated, once this picks up, overall, the kind of vaccination coverage that we hope to see will definitely improve over a period of time. It's always like our cricket games. Initially, there will be some hiccups, but we should not get discouraged by it. Finally, I'll say, I'm very careful to use this word vaccine hesitancy. In India, we generally are not really worried about hesitancy. People do participate in the vaccination program a lot, but by using this as the reason, I think we are probably looking away from the systemic problems that we need to address.
All right. It's one of the issues, but not one of the main issues. Well, thank you so much, Dr. Shenoy and Professor Babu, for joining us on the show today.
Thank you.
Well, it's time now for our viewer question segment, and we're joined by Dr. Aparna Jaiswal, Director, Department of Cardiology, Fortis Escorts Heart Institute, to answer your question. Thank you so much, Doctor, for joining us. And let's listen into the first question.
I'm Anjali from Gurugram. I wanted to ask that since the number of cases are decreasing in India day by day, so do we need the vaccine now also?
Well, I think to answer your question simply, it's very reassuring that our numbers are coming down, but we must remember that coronavirus is here. It's all around the corners. So we must remember we should not get caught unawares. We certainly must get vaccinated. So that's one. Second, you don't know about how this virus is behaving. You have crests and troughs in most cities, and you don't want to get caught on the crest and you could have the virus infected. And the third thing you must remember is we have seen very erratic behavior with this virus, with serious consequences in a few where you did not expect them. So the answer to your question is that we have to remain vaccinated until we can actually conquer this virus and have it out of our globe. So yes, we must get vaccinated.
Right, there should be no false sense of security if numbers are coming down in your area. Let's listen into the next question.
I'm Rohit Rathore from Delhi, and my question is, do I need to wear mask and avoid close contact with others if I have gotten 2 doses of vaccines?
All right, so do you still need to follow those COVID protocols after being vaccinated?
Yeah, so I think that's a wonderful question, because people already feel that even those who are not vaccinated, seeing that the numbers have reduced, they're going all around the city. We must understand, even after 2 doses of vaccine, we must remember that we have to have COVID sensitive behavior, meaning wearing masks, not socializing, keeping good distance between all of us. The reason being, we don't have a vaccine today which is going to give us 100% protection from this virus. So you must remember, even if you've been vaccinated, please remain COVID sensitive and follow the behavioral patterns that we have been advocating for over a year now.
All right. Thank you so much, Dr. Aparna Jaiswal, for joining us and answering those questions for us.